Hello everyone. In today's Explain My series, we are going to understand a simple concept, that is why hypothyroid patient gain weight in spite of poor appetite. This is one of the commonest complaint which will be given by an hypothyroid patient. Hypothyroid patients usually they are on the healthier side because of the few reasons that we are going to discuss. They will eat a little bit, but they will keep on putting on weight. So let's try to understand why this happens in hypothyroid patients. So first of all, the hypothyroid patients will have a decreased basal metabolic rate. The basal metabolic rate is determined by the activity of many pumps, and out of them one of the important one is sodium potassium ATPase pump. In hypothyroid patients, the sodium potassium ATPase activity is going to come down, so naturally the basal metabolic rate is going to come down. And if you think about the basal metabolic rate, it contributes a huge thing to the energy loss. We always think that at rest the energy expenditure is very less, but BMR, that is the basal metabolic rate, contributes around 60 to 70 percentage of the energy output. Even if you are not doing anything, you are just sitting simply still, this much amount of energy is being lost in the basal metabolic rate. And hypothyroids, let's say it goes down to 50, what is going to happen? The hypothyroid patient is not able to do a 10 percentage energy expenditure in comparison to the normal person, and this 10 percentage on an everyday basis is going to accumulate and it is going to gain a lot of weight in a hypothyroid patient. Next thing is there will be decreased fat metabolism and fat mobilization. If the fat is not getting metabolized, they are going to get accumulated and they are obviously going to increase the weight of the hypothyroid patient. And decreased thyroid hormone increases levels of cholesterol, phospholipids and triglycerides. That is why it is very essential for the hypothyroid patient to get treated themselves. Even though they don't outwardly show any defects to begin with, these are some long-term defects they can have. They will have high cholesterol, phospholipids and triglyceride levels. And fat deposition in the liver, it also starts to increase in a hypothyroid patient. So it is so essential that the thyroid hormone should be mandatory for maintaining the BMR as well as the fat metabolism, which gets deranged in case of hypothyroid patients, leading on to an increased weight gain. Even though since their BMR is not high, these patients, they will have a poor appetite. They will not feel liking to eat much, but still they will put on a lot of weight. Whereas the reverse happens in case of hyperthyroid patients. These patients have a high BMR. So what is going to happen? They will not gain weight in spite of increased appetite. So it is going to be reverse. So this is one clinical clinching point to diagnose a case of hypothyroids. I hope it's clear. Thank you for watching the video. We'll see you in the next video. Thank you so much.